So I am not going to talk about AI. I'm actually going to talk about the human experience in this, and I'm also not even going to talk about the HCP. So before I go any further, a quick introduction. I am Libby, I'm from Lilly, and I work in the global patient success team, which means I get the privilege and the honor every day to solve specifically for how we help patients start and stay on our medicines. So, although my training is in medicinal chemistry, my experience has been in the commercial side of the organization, and I truly am passionate about how we can make our medicines reach their full potential for patients. Full disclosure, I do work full-time at Lilly, and I do these talks across different parts of the industry. So let's jump right in. Imagine that you have had a fantastic HCP with a brilliant customer experience, and they've decided to give you a medicine, a life-saving medicine. You can afford it, you trust your doctor, and perhaps you even know that you need to take it. And yet, you don't take it. That is the reality for 50% of patients with chronic illness right now. Not because they're lazy, not because they don't care, but because they're human. And yet our KPIs, as we heard earlier today in Wayne's conversation, are still focused on new patient starts or new prescriptions. And maybe we need to be thinking more broadly about how we retain patients and expand our reach. So let's give an example of a classic target patient. So here's Esme. She's 50 years old, she's got type 2 diabetes, and she's a high-risk individual for complications, experiencing it firsthand from family incidents. And she's highly motivated to start her medication. She wants to spend time with her family, wants to spend time playing sports with her child. So she starts really well on her medicine. She downloads the app, sets medication reminders, and even collects and takes her first dose. But 3 months later, despite all her efforts, she stops taking the medication because life gets busy, work gets busy, and actually taking that medicine feels more like a chore than it does feel like healing. And it's this that we need to solve for. Now, it's not that Esme isn't the right patient, the ideal patient. It's that she's a real patient, a real human. And I'm sure I'm not telling you guys anything new yet, because you're all innovators here in the room, so you're already trying to solve for the patient experience. Perhaps you're already increasing knowledge through patient websites or apps that help people have reminders, or perhaps some of you have got some other innovations to support patients. And we have to admit that over the last few years, medicines have got incredibly impressive, and so has the patient experience. But have we moved the needle on adherence? No. That 50% measure has continued to be true year after year after year. So we need to think differently about how we define the patient experience. Because despite having better medicines, more apps, more information, more websites, we still see that treatment abandonment persists. And what's actually really concerning is it's early treatment abandonment. So people are getting prescribed the medicine and not even collecting it from the pharmacy the first time, the second, or the third. So why does the treatment abandonment persist? It's because human beings don't make decisions like spreadsheets. We make decisions like humans. So what does that actually mean? We have great customer insights that maybe show us observable behaviors. Did they get prescribed? Did they collect their prescription from their pharmacy, or perhaps did they turn up to their appointment? And some of you might go a step further and do some market research, which is great, and people will answer the questions that you ask them. They'll tell you a rational reason as to why they didn't take their medication. And they can even tell you about the choices that they make, but actually what they're telling you isn't real. Their behaviors are defined by a series of irrational beliefs right underneath the surface that we cannot see. Present bias, people care more about the now than the future. The IKEA effect, when you get involved in putting something together, you're more likely to want to do it. Friction costs, where the smallest thing stops a huge, big intention. And it's these things that we really need to address with our customer experience and our patient experience. Don't believe me that it's impactful? That's fine. I can give you science. Let's take it out the context of pharma, and let's look at reducing calorie intake. I'm in the UK, and in the UK, they put these traffic light colors here on our food to see if it would help people by giving them more education to reduce their calorie intake. And it does, right? 4% less calorie intake. Move the needle. Then we decided to remove the chocolate bars from the counter where you go and pay, and we put healthier choices. So we were more aware of the healthier choices, and again, it's moved the needle with reduced calorie intake there by 7.5%. But it wasn't until we made the behavioral intervention that circumvents this irrational belief system and made the healthier choices default that we got the impact. So if you take nothing away except this, it's that behavioral interventions are the things that we need to be thinking about to make the real difference for any human experience, but especially patient experience. Let me show you a real life example. So I'm not going to speak to which product it is, but we're going to talk about injection hesitation. So rational thinking would say that if someone gives you a stated preference that they don't want to take a medication because they don't like injections, we might go all the way back to our product line and change it into an oral medication. Do oral medications get better adherence? No. So maybe instead you think about hiding the fact that it's an injectable. We'll cover the needle, we'll tell them loads of great things about it, but we just won't really mention that it's an injectable. And that definitely doesn't work because we're not rational beings, we're human. So if we understand the drivers that are defining the behavior, we actually come up with a different solution. I'm just going to give you one example here. So what's actually happening under injection hesitation is the fact that we have this ambiguity aversion. So this is the fact that as human beings, we'll choose the more familiar than the unknown. So how this plays out is that people actually go for things that are less effective or have higher risk just to avoid the discomfort of uncertainty. Completely irrational, but our reality. So now if you understand that, instead of hiding away the injectable information, you want to pull it to the forefront because you now overcome the uncertainty. Same insight, different solution, different impact. I know I said I wasn't going to talk about AI, and I'm not. But perhaps it does tell us who is most likely to stop. But I believe behavioral science really tells us why. So how do we leverage this information? We're doing this at Lilly already, but I can give some tips. They're not dissimilar from what was being shared today, but the first one is really to design the treatment experience. We put so much effort into designing the molecule and so much effort into designing the HCP experience, and then as soon as they start, we forget to design the treatment experience. So let's really be thinking of the patient's first 30, 60, 90 days. Second, let's use data with empathy. This is twofold. Firstly, the data that we use and we get for patients is people's sensitive, personal health information. It is not just fun numbers for us to play with, so let's be respectful of that. But also, how can we use that data to be empathetic? For example, a piece of data without empathy is a notification to say you missed a dose. Data with empathy is something that says, hey, this is normal, let's get you back on track. Ooh. 3 is empower the humans. We've talked about it a lot here, but adherence truly doesn't happen on a dashboard, it happens in the conversations. The conversations a patient is having with a healthcare professional, or they're having with their family or friends, or actually often the conversation they're having with themselves. 4 is about building confidence, not compliance. So compliance says, do this. Confidence says, you can do this. Okay? So how do we really build people's confidence? Because success breeds belief, belief breeds behavior, and behavior breeds the health that clearly we want these patients to have great outcomes with. And last but not least is, please, let's redefine the KPI. Let's stop stopping at new patient starts. Let's really broaden the way that we define success for patient experience and be thinking beyond to retention and expansion. I'm really hoping that this is the right audience in the room that can actually take that away and make a real impact here. So the challenge is not for us to have an ideal patient, but to really acknowledge that they are real patients that use our medicines. So let's design for the way that people actually behave rather than the way that we wish they did. And then that can make the big impact. So Esme is a fictional case based on lots and lots of examples that we have, but also similar case to my own personal experience. So I can give you a very short personal story. In 2020, my dad was a similar age to Esme, and it was COVID, if you don't remember. And he decided through something he saw on the internet that he could reverse his type 2 diabetes by going on a ketogenic diet, which in his mind was kebab meat and cheese. But anyway, he managed somehow to get HbA1c levels down, blood sugar levels down, enough that his healthcare professional told him he could stop one diabetes medicine. What he heard was you can stop all your medicines, all your cholesterol medicines, all of your blood pressure medicines, and all of your diabetes medicines at once. And he had a stroke in 2020. Now, he's one of the very lucky ones, and he's still here, which is amazing. But it just shows that what we do is really, really important. And perhaps if he had the right information at the right time, delivered to him in a way that was relevant to how he actually is, rather than what he should already know or he should have heard, it would have been different. So I just ask really that you think in all of this today that of course it is about omnichannel and it is about AI, but I know that I'm here specifically for patients, and I hope that that's true for many of you too. Okay, it's shorter. I was so worried I was going to go over. Thank you so much for your time today.